Do you experience hip or groin pain when squatting, sitting for a long time, or during sports? Or do you feel like your hip is stiff? A possible cause can be femoroacetabular impingement. Hi everyone, and welcome back to the European Hip Center, the channel where we break down everything you need to know about hip pain, hip conditions, and recovery. In our Hip 101 series, we explain hip conditions so you understand what is happening. Today, we're going to talk about femoroacetabular impingement. Most people are told, your bone is slightly misshaped, and that is technically true, but it doesn't explain why some people never develop symptoms while others do. Femoroacetabular impingement, or in short, FAI, occurs when the hip ball and socket have reduced clearance during movement. There are two types of impingement, the cam and the pincer. Both lead to premature collision and thus restriction of movement. The cam morphology is a type of impingement where the femoral head is slightly aspherical, like this, while the pincer morphology is a type of impingement where the socket covers too much. But here's what matters. Impingement is not a static condition. It is a dynamic mechanical conflict. It only becomes problematic when repetitive load, high flexion angles, or rotational forces are applied thousands of times. This can cause pain and over time lead to labral and cartilage damage. That is why athletes and active adults often present earlier. As mentioned earlier, there are two main types of impingement, cam and pincer. Both can occur separately, but most patients have a combination of both. And although it can occur in both sexes, we see that a cam impingement is most common in men, whereas women are more likely to experience a pincer impingement. Impingement occurs in 10 to 15% of the population, primarily in young active adults, but in athletes, for example, during football or dance, this can even reach to 50%. A cam impingement develops primarily during adolescence, around 12 to 16 years. This is a period where the growth plate has not yet closed, and if high-intensity sports are performed during this period, particularly sports requiring extreme movements, a cam can develop. This is because repetitive loading can cause the hip ball to become flattened or asymmetrical. With a pincer impingement, the cause is less clear, but we think that this type of impingement is congenital. Pain from FAI is a deep groin pain that is triggered predictably in flexion. For example, during sitting for long periods, sitting in a deep seat, while cycling, while driving, or during squatting. Because it is a dynamic conflict, patients experience reduced hip mobility with progressive stiffness in the muscles surrounding the hip joint. Some patients may even experience clicking in the hip when bending or twisting. FAI itself does not cause pain. Pain only occurs with underlying damage, such as labral tear or inflammation of the joint capsule. These structures transmit pain signals when they're inflamed or damaged, for example, after a sudden movement or overuse. Diagnosis typically involves clinical examination, x-rays, and an MRI scan when labral damage is suspected. During clinical examination, we usually observe reduced mobility, often characterized by a catch. This is a sudden stop that you feel during clinical testing of the hip. In addition, we check if we can provoke recognizable pain symptoms. X-rays show us the type of impingement and possible wear of the joint. It is important to note that someone who shows an impingement on X-ray does not necessarily have to experience symptoms. In early impingement, the labrum absorbs most stress. Later, cartilage begins to delaminate, and once cartilage wear accelerates, joint preservation becomes more difficult. The window for intervention is not infinite. This does not mean that everyone needs surgery, but it means timing matters. Whenever possible, we always opt for a conservative approach, focusing primarily on exercise therapy. Exercise therapy strengthens the muscles around the hip, providing more support. Also, core stability is very important in learning strategies to prevent impingement. In addition, it is also important to modify activities to maintain unnecessary triggers. Anti-inflammatory medication may be considered when the hip is inflamed to such an extent that it interferes with exercise therapy. If symptoms persist, a hip arthroscopy may be considered. The goal of arthroscopy is to restore clearance, preserve cartilage, repair the labrum, and normalize joint mechanics. But surgery is not magic. Outcomes depend heavily on cartilage quality, patient selection, surgeon's expertise, and structured rehabilitation. Okay, so to summarize it, the three main things to take away. Or, for our Dutch-speaking viewers, en wat hebben we vandaag geleerd? FAI is a common cause of hip and groin pain, especially in young and active people. Due to mechanical conflict, it can accelerate or contribute to cartilage wear. And the earlier mechanical conflict is understood, the more options remain open. Activity modification, structured rehab, or preservation surgery. Thanks for watching. If you have more questions or like to know more about your hips, you can follow us here on YouTube for more, or check out our website at www.europeanhipcenter.com. We also have an Instagram page, so definitely check us out there too. See you next time.